The Omicron variant of COVID-19 was suspected to be circulating in Guyana just over a month ago by health experts. Its circulation brought about a sharp rise in hospitalizations, new cases and deaths. For the month of January, more than 18,000 cases of the virus were confirmed, with less than 40% of the active cases being hospitalized. But as rapidly as the infections rose, they are seemingly plummeting since health authorities implemented the new testing guidelines. This is to be expected since a decrease in testing would result in a concomitant decrease in recorded new infections. Just last week, the Ministry of Health announced that it would only provide COVID-19 polymerase chain reaction PCR testing for persons who have been hospitalized and those who have been in high-risk environments. In addition, rapid antigen tests have been set aside for persons exhibiting COVID-19 symptoms, radically limiting tests for asymptomatic persons since the testing sites were being overwhelmed. During his COVID-19 update on Monday, Minister of Health Dr. Frank Anthony said that there are 11,610 active cases of the virus, with 133 hospitalized and 11 in the intensive care unit.
This number came down from what it was a couple of days ago, and what we have noticed is that there have been a downward trend over the last 2 weeks or so. So our positivity rate has been falling. That means the amount of tests that is being done and the amount of persons coming back positive, that has been falling. So it shows that we are getting less cases.
But with only a fraction of persons able to access testing, the current number of active cases, as reported by the government, is obviously inaccurate. This new testing policy by the Health Ministry will inevitably make it impossible for the true COVID-19 situation locally to be revealed. Preliminary findings from 2 clinical trials in South Africa, where the Omicron variant was first reported in November 2021, suggest that the variant has a higher rate of asymptomatic carriage than earlier variants. Meanwhile, the Infectious Diseases Hospital at Liliendal has been operationalized to cater for patients requiring dialysis and other medical interventions.
If a patient needs emergency surgery, we have an operational theater, a surgical theater at Ocean View where we can do emergency surgeries. If a patient needs emergency cesarean section, we can do that at the Ocean View facility. And of course, with all the other underlying illnesses, we have the capability of treating patients there.
The current COVID-19 regulations have been extended throughout the month of February. The national curfew remains at midnight to 4 hours. A prohibition has been retained on social gatherings, private parties, use of pools, and other recreational spaces. Temika Rodney reporting for the HGB Nightly News.